Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension. Why is it caused? How it matters? And most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today.
Hello everyone, good afternoon. Myself Dr.Suchismita, Assistant Professor, Department of Cardiology, SCB Medical College, Cuttack, and Consultant Cardiologist, Heart and Plastic Surgery KR, Cuttack.
So, doctor, by now we all know what hypertension is. But can you please elaborate on it? I mean, why is it so important for us to take care of ourselves even when we feel fine?
The hypertension is a silent killer. We all know that it is known as a silent killer. Why so? Because first of all, the hypertension is the blood pressure is the pressure that the blood column exerts on the vessel wall. So when the pressure increased, that is called hypertension or high blood pressure. So this increase in the blood pressure usually doesn't cause any symptom. When it rises very suddenly, then only it causes some symptoms like headache, blurring of vision, or sometimes stroke. But most of the time it rises very gradually. So when it rises gradually, it usually doesn't cause any symptom. So just because you are feeling fine, that doesn't mean that your blood pressure is normal. You have to go for the checkup of the blood pressure regularly after the age of 40, so that you can detect the rise in the blood pressure at the early and you can treat it and become normal. Because if the blood pressure is elevated for a prolonged time, then what it causes is it causes damage to the vessel wall, because it is the pressure which is exerted on the vessel's wall. So it will cause mechanical injury to the blood vessel's wall. Once there will be a mechanical injury, the lipids, the cholesterol and all other things get deposited there and gives rise to the plaques. And hence this causes the damage to the various important organs of our body. Like if the blood vessels of the brain get damaged or get blocked, it can cause stroke, and the blood vessels in the heart, they can cause the myocardial infarction or heart attacks. The blood injury to the blood vessels of the kidney can give rise to renal failure. It can give rise to the various eye problems, vision problems in the retina. So many. So it should be diagnosed very early. It should be picked up very early, and it should be treated, and our blood pressure should be kept at a normal level.
So, doctor, I would like to know, what are the most common reasons people develop high blood pressure? Is it genetics, lifestyle, or something else?
Most of the time, 90 to 95% cases, the hypertension is the essential hypertension. Means it is the hypertension which occurs in the elderly population, and there is multifactorial cause like the genetic and lifestyle factors. So if the parents are having blood pressure, so there is more chance of developing hypertension at the elderly age group. And also the lifestyle factors like obesity, smoking, and the sedentary lifestyle or stress, anxiety, all these factors gives rise to the development of the hypertension. And in 5 to 10% cases, there are secondary hypertension, where there is definite cause for development of this hypertension. Like this usually occurs in a younger age group population. For example, suppose the patient is having some renal issues, they can develop hypertension in renal failure patient or in renal diseases, and also some endocrine problems, that is some hormonal problem. In those cases also they will develop hypertension at an early age. But most of the hypertension, 90 to 95% hypertension, are essential hypertension, which occurs usually in an elderly population, and both genetic and lifestyle factors contribute to the development of this type of hypertension. So we should always regularly check our blood pressure, so that we can pick it up early and we can keep the value at a normal range. It doesn't matter how much number of medications you are taking or at what doses you are taking. It is important what is the number of your blood pressure. So this number should be kept normal so that there will not be further damage to your vessel's wall, because it will not cause any symptom outside, but it will gradually cause damage to your vessel's wall.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
In American Heart Association guideline, the ideal blood pressure is always 120 over 80 millimeter of mercury, and if it is more than 130 over 80 millimeter of mercury, then it is called hypertension. And between 120 to 130 systolic blood pressure, you can say it pre-hypertension stage. So along with that, the hypertension is also graded to stage 1, stage 2 and stage 3 hypertensions. So accordingly, the severity of the hypertension are classified and you have to treat accordingly. Suppose a young patient and having elevated blood pressure in the first recording, and you are thinking that there may be some contributing factors to this elevation, like the patient is in stress, anxiety, and he has a obesity, lifestyle is not proper, then you can try for the lifestyle modification first. It is not necessary that every time immediately the medications will be started, but you can start with lifestyle modification. You can wait for 3 months and then you can reassess the blood pressure, but the blood pressure should be reassessed regularly.
So I would also like to know, if someone has just been diagnosed with high blood pressure, what are the changes you would want them to make in their daily routine?
On first diagnosis, the blood pressure is at very high level, or you are finding a target organ damage. Suppose there is damage to there are some cardiac issues, there is some renal issues, then you have to treat it with medications. Along with that, lifestyle modification should be continued. And it is not mandatory that most of the time it is a lifetime disease and you have to treat for the lifetime. But if you are picking it early in a young population group and you are thinking that the causative factor is the only stress or anxiety or its lifestyle or obesity, so you can also advise the patient for lifestyle modification, and you can wait and you can pick up the lowest effective dose of the medication, the lowest dose which is effective for that person, and you continue that lowest effective dose, and you can gradually decrease the dose, and you can also stop. Sometimes you can stop medication, but after stopping you have to reassess the blood pressure regularly. It is not like that you stop the medication and you go and sleep and you don't check your blood pressure and it suddenly will come with a very high elevated blood pressure. If your weight reduction, if you are obese, you have to reduce the weight, and the salt should be restricted to less than 2 gram a day, or ideally 1.5 gram per day, and you avoid smoking and caffeine intake, and also you have to avoid excessive alcohol intake, and you have to follow a proper diet that is called DASH diet, which is both based on more fruits and vegetables, and the food which are very rich in antioxidant. And the most important thing is you have to go for exercises. Daily regular exercise can decrease your blood pressure to a optimal level. So what are the recommendation of exercise by American Heart Association? It is around 25 to 30 minutes per day, or it's 150 minutes per week of exercise. Always it can keep your heart rate and blood pressure within a normal range, and this and you have to avoid the stress or anxiety. Proper good amount of sleep for every day is very essential for keeping your blood pressure at a normal level.
Can we say that hypertension can be treated without medication?
We have to go for regular assessment of your blood pressure, and whenever required, as per your doctor's advice, you have to take the medications, and along with the medications, if you continue the lifestyle modifications, then definitely your blood pressure will definitely come to normal level, and you can also you can continue with the lowest effective dose of medications.
Okay, doctor, you just talked about medication right now. So I would like to know, what are the most common side effects that people should look out for while taking medications for hypertension?
The blood pressure medications are very safe. But some side effects are always there with all medications, like some group of medications, antihypertensive medications, they give rise to the ankle edema, the swelling of the foot. So you can consult your doctor, you can change the medications. It is not important that which medications you are taking. It is important for your doctor and for yourself also to find the right drug at the right dose and for the right person. So you may not be tolerating the one drug, you may be developing the swelling in the foot, like that side effect. You can change your medication to some other group of drugs. And also sometimes it can give rise to, if you are taking the blood pressure medications, it can give rise to the postural hypertension. Suppose you are sitting and standing up immediately, then you may feel the reeling of head, you may feel like falling down. So these are the side effects of some commonly prescribed antihypertensive medications. And sometimes some diuretics group of blood pressure like chlorthalidone, they can cause the depletion of the sodium level. Basically in the summer season, you have to assess your sodium level, or if you are facing some side effects or something, you have to report it to the doctors, so that he can assess you what are the things that are going on, or is this a side effect of medication or it is something else. So you have to assess your sodium level regularly if you are taking some diuretics group of medications. So it is important to identify the right drug in a right dose and for the right person. So it is not important that how many of drugs you are taking and at what dose, but your number should be kept normal.
Okay, when you say reassess regularly, how often people should check their blood pressure and what's the best way to do it right?
If you are diagnosed for the first time, you have to check it daily in the morning and evening. Or if you are having diagnosed with some target organ damage and you have a very highly elevated blood pressure level, then you have to check it on the daily basis in the morning and in the evening time. But once you reach at a stable phase, then you can check your blood pressure 2 to 3 times a week, and you can go for a regular checkup of this if there is any untoward elevations or there is fall in the blood pressures. And there is some protocols how you will measure your blood pressure if you are measuring it at your home. So before checking the blood pressure, you should be mentally well relaxed, and you should sit comfortably, and you should be relaxed for 3 to 5 minutes. Then you have to tie the cuff, and you should avoid taking caffeine or smoking before measuring the blood pressure. You should not talk while measuring the blood pressure, and your arm level should be at your level of the heart. So like this you have to measure your blood pressure at home, and you can monitor at home also regarding your blood pressure, and you can consult your doctors if you are finding any elevation or you are getting any very low blood pressure at your home monitoring. So these are the protocols how you will measure your blood pressure. And some people are very interested to know if as it is a silent disease, it doesn't cause any symptom. So if you are not measuring your blood pressure or you are not checking your blood pressure, what harm it will cause later on.
I would also like to know what would happen if high blood pressure gets untreated for years, especially the body parts which gets affected the most.
So it's a very dangerous disease. It is a silent killer because it will not produce any symptoms. So it will gradually cause damage to the blood vessel wall. Because the pressure exerted on the blood vessel wall is high, so it will cause mechanical injury to your blood vessels. So there are blood vessels in every organ in our body, like the important organs in the brain, in the heart, in the kidney, in the retina. So these blood vessels once get damaged, they can give rise to many diseases like heart attacks, the brain strokes, kidney renal failure, and retinopathies, and dementia, early dementia, and so on. So many the dangerous diseases can be developed later on. So you should check your blood pressure. You should properly follow your instruction of your doctors, and you should keep your blood pressure level at a normal range.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share, and subscribe, and share your valuable insights with us. Always remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mitisha Gupta signing off from this podcast, Win Over Hypertension.